Good evening. My name is Dorinda Robinson, and this is my public speaking course. How many of you currently have health insurance or at one point in time did not have health insurance? Well, first let me ask, how many of you have health insurance right now? How many of you have been sick but did not have money to go to the doctor because you could not afford health insurance? The sad truth is, majority of us have been down that road, and I can say, as a single parent at one time, I definitely experienced that. Working 2 jobs and not being able to afford health insurance. We are often faced with enduring sickness and praying that we can make it through. With businesses closing because of the economy, more and more of us do not have health insurance. And again, we're often faced with enduring the sickness and hoping for the best. According to Answer.com and UrbanInstitute.com, there are about 12 million legal Americans that are uninsured in the United States. There were a total of about 9 million that were children that were uninsured. Now, it's kind of hard to fathom that we're here in the United States and yet over 12 million people do not have health insurance. Today, I hope to persuade you that we are in need of health care reform. I'll show you that everyone should have health insurance, and it will help to prolong people's life and reduce the overall cost by having uninsured people go to the emergency room instead of their primary care physician. So basically, a majority of the people who don't have health insurance don't have a primary care physician. Therefore, if they're faced with the flu or cough or really not certain of what's going on, they go to the emergency room, which ends up costing us more money instead of them being able to go to a primary care physician. Now, why do you think that is important? Why do you think this is an important matter in the first place? Now, I know firsthand how stressful it is not having health insurance and praying that you or your kids don't get sick because there's no extra money in the budget for health insurance. I have always worked, but at one time or another, my employer did not afford, or I wasn't able to afford health insurance. Providing health insurance to everyone contributes to prolonging a person's life. They are able to get the necessary care that is needed because they have health insurance. A person with health insurance will have the necessary tools and resources that will assist in detecting health concerns ahead of time. Health insurance is being proactive with possible illnesses and diseases. It also serves as preventive care. One thing that people have with health insurance is preventive care. If we're sick, or before we even get to that stage, we're able to go to our primary care physician if we have health insurance, and it can detect certain things ahead of time, like if you have what you think is a cough, but it could be something more serious. But being as though you're able to afford health insurance, you're able to afford going to your primary care physician, which serves as preventive care. And I think preventive care is the key when it comes to health insurance, so that we're able to be proactive on our health and go to the doctor when we need to instead of not being able to afford going to the doctor. Now, didn't you find the stats that I gave you that about 12 million Americans are here in the United States without health insurance? An overwhelming number. I know with me, you look at the United States as being able to provide the necessities for everyone, and the astonishing numbers that over 12 million did not have insurance. I mean, it was overwhelming for me. Now, according to Bustle.com, healthcare reforms may help people who are unable to afford healthcare benefits or in accounts of layoffs, and the inability to afford high premiums required for individual health insurance premiums. I know sometimes we have companies that offer employees health insurance, but if you look at the premiums, again, it's still a big chunk that's taken out of a person's check, and we're sometimes faced with having to balance everyone and asking, okay, if I'm able to afford health insurance, or if I decide to get health insurance, I'm going to have to basically look at my other expenses and have to delete something. Now, can you see the importance of being preventive and the importance of everyone having health insurance and the importance of having health care reform? Now, according to healthcare.gov, under the Affordable Care Act, you and your family may be eligible for some important preventive services which can help you avoid illnesses and improve your health at no additional cost to you. Now, having the freedom to choose your doctor, being able to provide health care for your family because it's cost efficient, and being able to provide preventive care with that health care reform will allow you to do that. Now, according to WhiteHouse.gov and NewYorkTimes.com, health reform makes health care more affordable, holds insurers more accountable, and expands coverage to all Americans, and make our health system sustainable. Now, on March 23rd, President Obama signed legislation to overhaul the nation's health care system and guarantee access to medical insurance for millions of Americans. Now, under that plan, a few things have changed. Now, if you have health insurance with your employer, if you have a child that's 26 years or older, they can still be under your plan. At one time, it was 21. So, with that said, if you have a 21-year-old, majority of the time they may be still in school. But with that new health care reform, you're able to have your 26-year-old still on your health care policy. Not only that, but it will provide insurance to millions of people, which again will be proactive. And that's the key, being proactive and prolonging health. And that's one of the things that healthcare reform would do. Now, a lot of people think that, okay, healthcare reform are for people who are not working, and that's just not true. If you have healthcare now and you haven't been faced with that problem, consider yourself blessed. A lot of people do not have health insurance, and they, again, are tackled with the stress of not having health care and not being able to go to the doctor when it's needed. Now, the insurance companies are also being closely watched, and they're going to have to start explaining themselves when they increase the premiums and not just do it because of the fact that they feel as though that's what they're going to do. So with the healthcare reform, it's also, again, making the insurance companies accountable for increasing the health insurance premiums. Now, it is important for everyone to have health care. We need to be preventive when it comes to our health and attempt to prolong our lives. I know at some time or another, either you did not have health insurance, or you know someone who did not have health insurance, and they went through a period without it. Now, it's important to have the resources such as health insurance so that we're able to take care of our health needs and be preventive. Now, I hope with this speech that you start thinking about the importance of health insurance and health care reform. Thank you for your time and your patience. Good night.